If you thought urinary tract infections were something you left behind in your younger years, you are not alone in being surprised when they start showing up again, more often and harder to shake after menopause. There's a real biological reason this happens, and understanding it puts you back in control. The biggest driver is a drop in estrogen. Before menopause, estrogen keeps the tissues of your vagina and urethra thick, moist, and resilient. It also supports a natural colony of good bacteria, mainly a strain called lactobacillus, that act like a first line of defense against harmful bacteria. When estrogen falls, that protection erodes. The lining of the urethra and bladder becomes thinner and more fragile. The local pH shifts. Harmful bacteria like E. coli, which the CDC identifies as responsible for most UTIs, find it much easier to attach and cause an infection. This cluster of changes has a name: genitourinary syndrome of menopause, or GSM. It covers vaginal dryness, burning, and urinary problems. It is extremely common, and it is closely linked to the spike in UTIs many women experience after menopause. Symptoms can also look different at this stage of life. The classic burning sensation may still be there, but sometimes the signs are subtler: increased urgency, mild pelvic pressure, or just a general sense that something feels off. It is also worth knowing that not every urinary symptom means infection. Overactive bladder and other conditions that become more common with age can mimic UTI symptoms. That is why getting evaluated by a licensed provider matters, rather than guessing. A few other factors raise the risk. As the bladder ages, it may not empty as completely as it once did. When urine lingers, bacteria have more time to multiply. Pelvic floor muscles can weaken after menopause, sometimes allowing the bladder to shift slightly from its normal position, a condition called pelvic organ prolapse, which makes full drainage harder. A history of frequent UTIs, sexual activity, diabetes, and certain medications can also add to the risk. So what can you actually do? Staying well hydrated is one of the simplest moves. Drinking enough water that your urine stays pale yellow helps flush bacteria out before they take hold. Try not to hold urine too long. Take time to fully empty your bladder and wipe front to back after using the toilet. Urinating soon after sexual activity is another commonly recommended step. On the treatment side, localized vaginal estrogen therapy, a low-dose treatment applied directly to the vaginal area, has been studied extensively. Research published in the Cochrane Database of Systematic Reviews found it can help restore the natural, protective environment of the urinary tract and reduce recurrent infections. It works differently from systemic hormone therapy, and many women are good candidates. That conversation is worth having with your provider. If you have been getting UTIs repeatedly, ask your provider about a longer-term prevention plan. You do not have to just manage each infection as it comes. There are real strategies, and you deserve that conversation.